From the moment a genetic disorder, a malformation or a stillborn child occurs in a family, people begin to speculate on why it happened. Sometimes those explanations can be very hurtful to the parents or the family members, and it's essential that you find out what other people think is the cause of the problem. Selena, Dominic, thanks for coming in. It's a pleasure to see you. My name's John Byrne. I'm the consultant in genetics, and I know you had been asking some questions about the loss of your baby. Can I ask what your baby was called?
David.
Okay, and how long is it now since David died?
It's been 2 months.
All right. What have you been told so far about the cause of David's problem?
We haven't been at all.
Okay. I didn't see David when he was alive, but we were sent all the pictures and all the details by the paediatrician, and also some x-rays taken of him, so I'm quite confident of the diagnosis in David. He had a rare genetic condition which we call thanatophoric dysplasia, which is, I'll write this down for you in a letter afterwards, but basically it's a very severe problem with a spelling mistake in a gene. And it means that his bones stopped growing too soon, and his ribs were so short that he couldn't breathe, and therefore he died. And all children with this condition do die, and so we can be very confident of the cause of the problem. Before I go on and tell you a bit more about that, I'd like to just ask you, this was your first pregnancy, wasn't it?
Yeah. Was
it a planned pregnancy?
Yes.
You were sort of thinking of getting pregnant, but you weren't.
Yeah, it kind of happened sooner than we were thinking.
Okay. Were you on any medications or any prescriptions from the doctor? And during the early stages of the pregnancy, before you realised you were pregnant, were you taking anything or doing anything, drinking or whatever, that you wished you hadn't been afterwards?
No.
You seem a little hesitant there. Was there something in your mind that you were uncertain about?
You only had a couple of drinks at the start before you
a
knew
couple
you
of
were
drinks,
pregnant.
yeah, a couple of drinks.
But then
obviously I stopped as soon as I knew.
Was there anything in the pregnancy that you think might have been a cause for the problem? Because people usually sort of think about what they did and think it was something I did.
Well, what does cause the disorder that you mentioned? What sort of thing are you talking about?
It's basically caused by a new mutation. It's a spelling mistake in a gene. So, in fact, whatever people think in terms of, usually they think it was something I ate or something I drank or something I took. In fact, there's no evidence that this could be caused by that. This is something that happened either when the egg or the sperm were being made, and it was a spelling mistake when the genes were being copied.
So it's nothing to do with anything that I might have done that I shouldn't have?
Nothing that you did when you were pregnant could have made any difference whatsoever.
Okay, well in that case I feel able to tell you that I did use cocaine once, and I worked out that it was a week or two after conception.
Has that been weighing on your mind a bit? That's quite common. I mean, people always look back to the pregnancy.
So it's got nothing to do with that?
Not at all.
Okay.
It had already happened before that point.
Good.
It's very important that, because people very often think about the pregnancy and think about an injection or a flu tablet, some medication or whatever, and they naturally assume that's the cause. Okay.
Right.
It's very important to really press people on what they think caused the problem. You will hear all sorts of old wives' tales. People very often think about events in pregnancy, often quite trivial events. They had a flu jab, or they had a viral infection, or they took paracetamol. But it's important to get that out in the open, because then you can deal with it and reassure people, usually, that it had nothing to do with the cause. Or if it might have been a factor, then at least you can talk through what that means, because of course the good news is, if that was the cause, then it wouldn't be the cause if they didn't take that substance in a future pregnancy. The main question that I know will be in your mind now is what happens next. So we've explained the cause of the problem, we've made a diagnosis in David. The good news is that this almost certainly began with David, and obviously ended with David because he couldn't have children, he didn't survive to have children of his own. So in theory, next time you get pregnant, there's no risk, no greater risk than anyone else. In fact, there is a slight increased risk. And the reason we've discovered is that these spelling mistakes don't always happen in the egg or the sperm. They could happen 1 or 2 steps further back up the production line. So you could have a group of cells in one testis where that spelling mistake occurred, and it's sort of in the blueprint. It's a bit like having a car factory where one of the lines is not putting windscreens in. So you get a stream of cars coming off that production line with a bit missing, even though the rest of the production system is working fine.
So how do we know how likely that will be?
Well, I can tell you that just from looking at other families in your position, it's actually a very small risk. It's less than 1% that this will happen a second time.
Right.
So the important thing, though, is that when you do get pregnant, we like to offer you a detailed ultrasound scan as a reassurance, because obviously in it, whatever I say, you're going to be anxious during the pregnancy, and having a detailed scan will give you a chance to make sure that all is well.
At what point?
Well, we would be able to say even as soon as sort of 11 or 12 weeks, the obstetric team would be able to see that the proportion of the baby's arms and legs looked fine. So, and sometimes people, kind of want to wait until they've got back past that stage before they announce the pregnancy. But I mean, to be truthful, the probability is extremely high that the baby will be fine. So I don't think you need to worry too much about it. But it will give you that extra reassurance to see that the scan's giving a normal appearance.
Okay.